Welcome to today's program. I'm visiting with Debbie Heesch from the Good Samaritan Society. She is a client services coordinator, specifically working with the LivingWell at Home program, which is actually a research project. Let's go back and do just a little bit of a history on this. How did this research study get launched?
We received a substantial grant about a year and a half ago, and it was because we wanted to study the impact technology would have on the ability for seniors to live more independently and live longer in the place they currently call home. Since then, we worked with a partner who our research liaison at the University of Minnesota and identified the areas that we wanted to cover, and the Wyndham surrounding area is one of those areas involved in our study.
And as you say, I know that dealing with some of my own family members, that desire to remain at home can be very strong, and now with some of the new technologies and tools out there, it is more feasible for people to remain in their home a little longer.
You bet, and that's exactly what we're trying to discern, is if certain technologies help people to be able to stay there longer. And is it a combination of those technologies? Is it one of them that makes the difference? That's why we're doing the research. We have three different types of technology that are involved in the research project. One is a lifeline pendant that you can wear and push if you need help, but ours also has an additional feature that is part of the research, and that is that if someone were to fall and not be able to push the button, it will still send a call for help. Additionally, we are studying telehealth, which is equipment that can take your vital signs right in your home. All of us have made appointments to head out to a blood pressure clinic or visit someone to have our vital signs checked after we've received a certain regimen of care, and now you can do that from home, and a nurse gets that detail each day that you take your vitals. The last one is the WellAware sensors is the newest piece of technology that people have heard the least about, and that is where we combine a record of the activity and movement in a home to discern what's the average, and then we identify times when the average changes, whether it's increased activity in a certain area or decreased activity. And then with the help of healthcare providers, we can visit with someone and find out why that change is occurring.
Well, let's talk about first, as you say, participants from 5 different states are being studied, but it's not the entire state, so there is a kind of a geographical requirement, and the Wyndham area is part of that. So
Right.
People listening to this should probably check with you to see if they're in a specific area that would be included in the study. But who are you looking for? Ideally, what should the criteria be of someone to participate in this study?
Well, there really isn't an age requirement, but there are 3 different categories that people could fall into, any one of these 3. The first is, have you been in the hospital in the last 12 weeks? Or have you been in a skilled nursing facility or rehabilitation center in the last 12 weeks? Or is someone eligible for both Medicare and Medicaid and have had a hospital stay or ER visit in the last 20 months, so almost in the last 2 years? If you fall into one of those 3 categories, you probably qualify for participation in the research project.
And what duration are we talking about? If somebody applies and is accepted for this study, how long would the study actually take place?
We ask people to participate for 1 year, but it's a voluntary project, and if you decide after 6 months or 6 weeks that it's not what you had envisioned or you need to make a move or a change, then you can drop out of the study. But we ideally want people to participate for a full year.
I suppose one question people might have is, will this cost me anything to participate?
Super question, and we do get asked that all the time. This is free. Anyone who participates in the study and receives the technology gets almost $10,000 worth of benefits in a year's period of time. So that's one half of the group. The other half of the group, our control group, who do not have technology but still keep track of their medical experiences and expenses, will actually be paid $75 as a thank you gift for participating at the end of 1 year.
Once again, we're visiting with Debbie Heesch from the Good Samaritan Society as they're recruiting volunteers to serve in a research study that will evaluate the effectiveness of using different types of abilities to monitor someone's health in the home. And as you say, the whole point behind this is try and decide which of these technologies or methods are going to be most effective.
That's right. Our goal is to identify the most effective tools and prove the effectiveness of these tools. And then we will be able to identify which of these technologies can allow people to stay in their homes for a longer period of time, delay transitions to the next level of care, but also we want to prove the effectiveness of the equipment so that this is a reimbursable expense. Currently, these types of equipment aren't covered by private pay insurance, Medicare, Medicaid. And so if we can prove that they save money and they work the best, then that's what the goal would be, is to be able to get them to be reimbursed. So it's available for everyone, not just a select few.
So if somebody is listening to this and that they would fit the criteria and it sounds interesting, is there an application process? What would somebody do if they want to be considered as a participant in this research study?
Well, here in the Windham area, we would have them contact our home care agency that's located on the Good Samaritan Society campus in Windham, and their phone number is 507-831-0734.
So the local home care folks, they would do the initial screening and evaluation to determine eligibility?
Right, just a simple phone call, and then we'd probably schedule a visit and come out and sign you up. It's very easy. The work of the participant is very minimal. A phone call a week to tell us about medical experiences and medical expenses, and the rest is all done by us.
Are you looking for a specific number of participants in each target area?
Well, we are looking for a total of 1,600 people, and we're well over halfway to that number. So it can be any number of people from your area. It's just the total number of people that we're looking at.
So again, if somebody is interested in participating in this research study on the Living Well at Home program, and you're hearing this in the Windham area, you should contact the Good Samaritan Home Care Agency at 831-0734, part of the Good Samaritan campus in Windham. Visiting with Debbie Heesch from the Good Samaritan Society. Anything to add?
Well, just that we're very excited about this opportunity. It allows us a chance to meet people in their homes and find out what services they need there and how we can help them to stay there as long as they would like to stay there.
Well, thanks for the information, and hope you get a lot of very valuable information from this study.
We appreciate your interest, and thank you so much.
That's our program on KDOM.